Oh, I found out the food name. It
What was
was
it?
wait, it disappeared. Sorry. It was caldereta
Oh,
and
it's
laing.
caldereta. Oh
Yes.
yeah. It's very popular here in the Philippines, but I think for my choice, I don't I don't eat much caldereta.
Ah, okay, okay, okay.
Caldereta. So yeah, so we have the Menti code 86151534. So I hope you guys could join in and engage with our poll so that we would know what do you guys feel today, and also to have a census if most of our participants here are already in what field or some are just students, so that we can, engage with them later on, and we will know what vibe or what how do we approach them early I for later. So yeah. So if you
Yes.
guys are
I do
having
have
tech,
my friends
yeah.
here, fellow students, right?
Oh yeah. Hello, future pharmacist. So guys, if you have any experiences, any technical difficulties, you can just chat here in the chat box. So we are trying to fixing it. Sorries.
For now, we can change our names first to your nickname and then underscore and your country. So for me, it would be Rena underscore Indonesia, and for Alex, it would be Alex underscore the Philippines.
Yes.
We'll start from that first. All right, maybe we'll ask everyone if they had breakfast. For everyone who had breakfast, can say yes in the chat. Did you guys have breakfast? And so you can share what you ate this morning before we start to the more serious part of the webinar. I'll start first in case everyone is shy. So I ate breakfast. Cookies for breakfast?
Wow, sugar intake first thing in the morning?
Yes, the spike.
How about others? Go, guys. You can just chat here. Feel free to chat anything and just feel like we're just talking to each other and something like that. But later on, we will go on a more serious side, more professional side of the field. Wow,
Right.
mango.
Maybe other than food, we can ask about what your roles is right now as a pharmacist or if you guys still students. I've seen some of my friends here. You can tell everyone that you're a student right now. I
Yes.
am a
So
student.
if ever the Menti is not working, you can just type here in the chat box what is your current background today, or in this, yeah, student, a lot of student.
Yeah.
Kiana, sinigang and pork tonkatsu. Wow. Okay. So, yes. Go
Everyone is so
on.
excited on sharing what they ate today.
Yes.
You can
So,
also share what you guys are doing right now as a student or as a pharmacist.
pharmacist. In what field, guys? Are you in regulatory, hospital, community, student, research? I think in other countries aside from the Philippines, I think pharmaceutical companies are more evident in
Mm-hmm.
guys rather than hospital and community setting. But I think community would be definitely a pharmaceutical company.
Where are you working right now, Alexa?
Actually, I am a hospital pharmacist in a government hospital here in the Philippines. So I work as an outpatient pharmacist. So that's it. I
Oh, it
used
must
to
be
be
really
working
busy
as
for
a
you.
community, but I prefer working as a hospital pharmacist.
Oh, nice, nice. All right, I think we have some information about our participants today. Most of it are pharmacists and companies and also regulatory and community. Yes, for the Menti, we have some technical problems as we are now proceeding it to just sharing in the chat for your roles right now. I think while we wait for the other input, we'll be inviting, since we have some input, we can conclude that there are students and also pharmacists from many sectors. So we are very diverse. So we're looking forward for everyone to have new knowledge and other parts of being a pharmacist that they haven't known. So hopefully this webinar will be very helpful for students and also the pharmacists. Okay, thank you everyone for your input. As you are aware, this online event is proudly brought to you by AYPG, the Asian Young Pharmacists Group, an NGO that brings together passionate and young pharmacists across Asia to learn, collaborate, and create meaningful impact. I am now inviting Mr. Frank as the president-elect of AYPG. To Mr. Frank, how are you, Mr. Frank?
Hello everyone, I'm Gray.
All
Hello.
right, nice to have you here.
Thank you.
We'll give the time and place for you to give you warm greetings on also the introduction to AYPG. To Mr.
Okay,
Frank,
no
the time is
problem.
yours. Thank you.
Thank you, Lisa. And can you share the slide for me or
We are waiting for we're sharing right now.
okay, thank you. Okay, hi everyone online, and I'm Frank from Taiwan and current president. Awesome. Hello everyone. I'm Frank from Taiwan and current president-elect of the AYPG, and I'm honored to take a few minutes to reintroduce the vision of AYPG. So, for those joining us the first time, AYPG is an NGO and independent organization that represent the voice of young pharmacists all over across Asia Pacific region. So, our mission is to empower young pharmacists to make a real impact both at your country and across the region. So as you can see in this slide, this is our current 2024 to 2026 term. As president-elect, I work alongside our president Angun, immediate past president Kimi, secretary general, and our four chairpersons. And but in AYPG, we are not only about leadership, we also have a team to execute our vision. So you can see there are 19 of our subcommittee. And I also want to acknowledge of our team behind today's event, our external, internal, and public engagement subcommittee. But also not forget our project subcommittee. So stay tuned for more event in AYPG, and you can learn our more events in our next slide. We have plenty of events. Today's webinar is one of our events. So we also just completed our AYPG Leadership Summit in Bangkok in October, and next year in Bangkok in Lombok in October, and next year we will have our AYPG business meeting in Bangkok in November 2026. And we also have our AYPG mentorship program. So I know there are some students. So after you graduate and become young pharmacists, we are really looking forward for you to join our family. And we have a mentorship program to let you think about your career and also have other webinar in the future. So stay tuned. And the following page, we have our social media that you can follow us and to learn more the latest information from AYPG. So LIPG currently have the three. Uh, we can switch to the next page. Thank you. Three main social media: Facebook, Instagram, and LinkedIn. So our publish engagement team is really working on a lot and work with other subcommittee to have latest news in this social media. And also we also have our newsletter. So in the next page, you can scan the QR code and subscribe our newsletter and also to read some information in our website. So it's my little introduction of AYPG, and I also want to thank about IPSF April and IYPG to collaborate of our event today, and really looking forward to the webinar later. Thank you.
Thank you so much, Mr. Frank, for your speech and also your explanation about what IYPG is. Thank you.
Thank you.
All right. So, can we request again to show the PowerPoint for the official newsletter of the AYPG? So that at this juncture, we would like to invite everyone to stay connected with us, and you can subscribe to our official newsletter by visiting our website at www.asianypg.org, or just simply by scanning the QR code on your screen. And of course, don't forget So follow us on Instagram, LinkedIn, and Facebook so you can just stay updated with our future events. So just like what Frank said, you can join our future events, other future opportunities that could help you grow for the student pharmacists here as soon as you become pharmacists in the future, and for us to the professionals, pharmacists that could have more opportunities in finding more learnings in our field. So more initiatives, opportunities to engage with fellow young pharmacists across Asia. So again, we invite everyone to subscribe to our social media platforms and mailing list. So this will keep you guys updated and be part of the Asian YPG. So yeah. So we'll be giving you a short moment to do so. So around 1 minute. Yeah. So let's go, guys. Be part of our newsletter.
Yes, I can't wait to join AYPG once I graduated.
Wow. Go, Nisa. We will see you here next year.
Hopefully. In 2 years, I still have my
Okay,
licensure.
2 years. Okay.
Will take some time. All right.
All
So
right.
while everyone is filling up the newsletter, hopefully, in today's session, we will also explore on how these models emerge, the challenges the pharmacists have seen and went through, and what the future holds for the pharmacy profession in our region. And maybe you can I'll start mentioning our speakers for today. We have Miss Janice Minwatana, we have Miss Lokaisin, and also we have Mr. Miko de Guzman.
So yeah, so Nisa, can you give us a glimpse for our lovely event today? Or yes.
All right. For
Mm-hmm.
our program, we will talk about what's happening in their own countries regarding their pharmacist roles. We'll start with Thailand, and then we'll move to Singapore, and then we'll move to the Philippines. We'll start exploring the role of pharmacists in how they would prescribe in their countries, especially in drugstores and pharmacies, and how this plays a vital role in improving the healthcare access and patient outcomes.
Yeah, and we are all excited to learn from them, right?
Yes. All right, we have Miss Janice, we have Miss Lokaisin, and we have Mr. Miko Dis Guzman. We'll get through their presentations one by one, and then we'll have our panel discussion together. I
All
think
right.
we'll start now.
So we can, first of all, we would just like to give everyone a glimpse of our lovely event today. So across Southeast Asia, the role of pharmacists has significantly evolved from traditional dispensers to essential clinical providers. So today, pharmacists are entrusted with expanded responsibilities, including prescribing, vaccination services, and other collaborative practice agreements. So in Thailand, community pharmacists are empowered to supply a wide range of medicine, including antibiotic for minor illnesses. And in the Philippines, pharmacists play a vital role in national immunization programs, strengthening the public health delivery. And meanwhile, Singapore has established a structured collaborative prescribing framework under the Ministry of Health, reinforcing interprofessional practice. So definitely, these developments reflect a shared regional commitment to accessible, patient centered, and pharmacist led care, and more than policy changes. So they represent opportunities not just for only for pharmacists, but also future pharmacists, to everyone, to every student here in the webinar, that they can represent or like their countries and their specific field in the future so that they can lead, innovate, and make a meaningful impact on patient care across the region. Right, Nisa?
Yes, we are so excited, and we are going to start with Thailand. As many of us know, Thailand has a unique system where pharmacists can supply certain medications, including some antibiotics, without a physician's prescription. Since this is very different from most of our countries in Southeast Asia, this is a very great topic to be talked about.
Yes, definitely, Nisa. So it is our honor to introduce our first speaker. She is an assistant professor and Deputy Dean for the International Program of the Faculty of Pharmacy at Mohidol University. So she brings with her an extensive experience in pharmacy education and international academic collaboration. So through her leadership and expertise, she has contributed significantly to the advancement of pharmacy practice and professional training. So we are privileged to have here with us today and to share her insights. Let us welcome Miss Janice Menwanthatana. Hello, Miss Janice. The floor is now yours.
Hi, good afternoon, everyone. Thank you very much for having me with the Asian Young Pharmacists group. And this is the first time for me to, join to this community. And I think you're gonna see a lot of sharing information regarding the role of pharmacists that we are expanding to the world. And as a Thailand perspective, I just would like to share some of the our experiences that we have with the prescribing the medication, especially in the drugstore, so that you can know how we practice in Thailand and what kind of system that we have covered as a pharmacist in this community. So let me share my slide first. Did you see my slide well? Okay, so this is just the cover of the slide presentations. I just would like to, give you a glimpse of the overall information about the prescribing perspective of the pharmacist in Thailand. So basically, just to give you a background, the position of the drugstore in Thailand. Uh, as far as the policy goes with the national health system by the Ministry of the Public Health in Thailand, as a pharmacist recently, we can do a lot of things to prevent the diseases, to treat the diseases, and also provide a service, and also to give the patient with the access that is actually in need for in general populations. As you can see the number on the each perspective, if you see in terms of the prevention role, we also have the role to do some disease preventions, and I can share you some more a little bit more information about that. In terms of the treatment that we can provide to the patients without any prescription, we actually can manage 32 common illnesses. This is the meaning of like if the patient comes to your drugstore and then you interview the patients, you have some idea whether or not the patient is, suffering from something, and this is not a red flag that, you bring the patient to hospital and this is manageable in the drugstore. You can actually prescribe the medications to the patients. And this is a 32 of the common illnesses that listed under the universal coverage. And this is the service that we provided by the pharmacist and as well as to get reimbursed by the government. Also, with the services as a Thai pharmacist can provide, this is just a pilot program. We are trying to use the drugstore to use the system for the e-prescription so that we can reduce the number of the patients that go into the hospital and they are so very crowded. And we try to minimize the workload of the hospital, especially in pharmacy, so we started to have some collaborations with the model in the drugstore to provide an e-prescription, but this one is still ongoing. And actually, we are going to have the service in maybe in the next 3 or 5 years. Another one or another aspect as a pharmacist in Thailand that we can do is to provide the access point to, a kind of like a service in healthcare. And it is an access for one-stop service in the community. Okay. And then these are the example of the health prevention and promotion that we can provide it in the drugstore as a pharmacist. And as you can see from here that you can provide the oral contraception to the patients or the women who are reproductive age or who are in need for the oral contraception. We can also provide the emergency contraception if you interview that they are appropriate to use these contraception methods, as well as we provide the free condoms for Thai citizens, and we also provide the pregnancy test kit, as well as the if you have the pregnancy women come to your drugstore, you can provide them with the iron or folic acid supplement for the people who are indicated, as well as to do some drug disease screening, such as in hypertension, diabetes, or a kind of cardiovascular risk. You can do some interview, you can do some scoring, and you talk to the patients so that we have some idea about the disease screening. If there are some red flags, at this point, we are going to refer them to the hospital. And we technically has a system for documentation to provide to the hospital what we have done or what we have done in terms of like the methods that we test to the patients, as well as what kind of management that we have done so far to the patients. We also have a HIV disease screening. We have some kind of practice kit to provide in a drugstore so that the patient can go and test by themselves and literally those HIV or something that is very sensitive information. You can just provide those kits to the patients, and then they will send with the cover envelopes, and that will be anonymously sent to the clinic to confirm results to the patients. And these are some of the pictures that I would like to share as a practice in the drugstore in Thailand. As you can see from this picture that we have a lot of the inventory of the drugstore and items in the drugstore. And these are the process. As a pharmacist, we can do some interview with the patients, and we actually have to think about the disease, especially in the common diseases, as well as to interview the concurrent medication that they are taking right now. And if we consider this is appropriate to prescribe the medication, we just pick the medication behind the counter to the patients and instruct them to take the medicine appropriately. And in the system, if you would like to get some reimbursement by the Ministry of Public Health, as a pharmacist, you need to submit a document, as well as a drugstore. You need to be accredited as a drug quality assessment, and it has to be qualified in order to get reimbursed by the government. And we also have some telepharmacy in the drugstore, usually in the prescribing methods that provided by the drugstore. You will need to follow up the patient, especially if you prescribe the medication for the patient for 2 or 3 days. You need to follow up them whether or not they are recovered, or a symptom that you think that the patient experiences are getting worse. You have to advise them to go to the hospital. So this is the telepharmacy that we provide in order to follow up all the information from those patients. And then we also doing some disease screening, and this is a photo for the blood pressure monitoring, as well as this is a counseling point in the drugstore that we usually provided in the specific area. And this is the a symbol in Thai to let the patients know that this is the drugstore that in the campaign that they don't have to pay anything. They can just go to the drugstore and then talk to the pharmacist and then get reimbursed that pay nothing for their symptoms. And this is the accreditation picture to let the patients know that this is the drugstore that they can go and get the medication for free. Oops. This is not. Actually, this one, I just would like to share. It's not a photo show. I just would like to show in this slide that the list of the common illnesses that we can prescribe the medication without prescription. For example, in a very simple infection, sore throat, urinary tract infection, or the non-complicated upper respiratory tract infections, or patient have a headache, patient have some dizziness, vertigo, those kind of things that we can manage in the drugstore. Uh, and you can prescribe the medication and follow the patients for 2 or 3 days, and then you get reimbursed. Initially, with this system of 32 common illnesses, we started out with just only 16 common illnesses first, but the response and the comments from the patients are so satisfied with this system because it reduced a lot of the crowding system in the hospital. So the government decided to expand the common illnesses to be 32 common illnesses that can be managed in the drugstore. This is going to be another next step as the pharmacist in Thailand, not just only as a prescribing medications, but also to expand our role in smart hospital, in farm care, as well as in supporting the longevity, not just only this is to prevent the diseases that we already know that a lot of the non-communicable disease we can prevent. So the pharmacist has also an important role on this one too. And then we are going to expand the role in terms of the pharmacogenomics in the community pharmacy as well. However, this community pharmacy who manage in pharmacogenomics, they usually require a short course training on top of the pharmacy programs that they graduated. So these are something that I would like to share as a pharmacist in Thailand. And if you have anything to share, maybe we can talk a little bit more about it. Thank you.
All right. Thank you so much, Miss Janice, for that really valuable insights. So to wrap up Miss Janice's presentation, so she talked about the the extent of Thailand's practice in community pharmacy, that we learned how Thailand's universal coverage scheme ensures healthcare for all. So, with community pharmacists as the first line of care, they step up not just only as dispensers but also as prescribing pharmacists that they can offer to the community, that they can prescribe medicines for common or mild illnesses, so that it also a way to or avenue to like what do you call this, avoid hospitals being too overcrowded, since some illnesses are going just back and back and back and back again. So they can just visit the pharmacists, community pharmacists in Thailand, and as dispensers and also prescribers, they could just give the medicines to the community. So wow, it is something that is very unusual here in the Philippines because we don't have prescribing pharmacists here. So we usually have the doctor's prescription before we dispense. So without it, we could not dispense any antibiotics, especially antibiotics here in the Philippines. And also we can just offer OTC medicines, but for antibiotics without doctor's prescription, we could not give it. So yeah. Thank you so much for that valuable insight, Ms. Janice. And looking ahead also, that is a smart move to Thailand community pharmacy involvement or like innovation. That looking ahead, robotic dispensing and digital health tools are helping pharmacists work more smarter and efficient, so giving them more time to focus on the patient care itself and clinical decision making. So that is truly shaping the future of pharmacy. So thank you very much, Janice. So I hope a lot of you learned things from this session. So yeah. So later on we will have a panel discussion. So if you guys have any further question, you can direct it to Miss Janice later on. So yeah, Nizel, what's next?
All right, thank you so much, Miss Janice. I think it was a really complete presentation. I was so amazed on how Thailand works with this prescribing. It's really helpful for everyone in the country. All right, thank you so much, Miss Janice, once again. As we move forward with our program, we will transition into our next speaker, where we'll be moving on to Singapore, a country known for having one of the most structured collaborative prescribing frameworks in Asia. Our second speaker is Ms. Lo Kai Sin, a senior clinical pharmacist in the Singapore General Hospital. She will share her experience in pharmacy education and also public health. Through her role as clinical pharmacy, she has contributed to good clinical practices, and she will share with us on how collaborative prescribing program in Singapore is conducted. Okay, do we have Miss Lokaisin now? Hello, Miss.
Hi, can you see my face?
Yes, hello, Miss. Oh, are
Okay.
you in the hospital right now?
Oh no, I'm just at a different event, but I hope it's not too noisy in the background.
It's
But
good. We can hear you
it's
guys.
okay. All right, that's great. So let me just share my screen. Can you see my slides?
Yes.
Okay, that's great. So I'll just start. So I'm from Singapore. My name is Kai Sing. I'm a senior clinical pharmacist in Singapore General Hospital. The prescribing program that we have actually started back in 2018. And It's a hybrid of supplementary as well as independent frameworks to this model. So basically, it aims to provide professional development, improve care access, optimize resource utilization, and help collect facilitate collaboration for ensuring safety and oversight. It's a 3-month program that's provided by the from the National University of Singapore, supported by the School of Medicine here, and it builds on existing skills of the APN and senior pharmacists with regular assessments and practicum as well. The pharmacists are actually accredited to prescribe under a CP agreement, which is a legally binding document under a particular department or scope of interest. So for myself, it will be rheumatology, but it can be anything. So it can be things like endocrine or renal, etc. And each competency will have to be maintained separately. The drug formulary, so the list of the medicines that we can prescribe, is actually pre-specified in the agreement and can be updated to suit any changes in prescribing practice. So there are also some organizational safeguards to monitor prescribing activities. So in-house, we do have a credentialing board, a clinical governance group, competency maintenance, as well as service review. And there are some guidelines, as you can see on the screenshot over there, that are established by the Ministry of Health on the implementation of the above in each institution. So what's going on now? So you can see here the image over there is the picture of my batch of collaborative prescribers during our last exam. So you can see here the benefits in Singapore. We realize that it actually helps to establish autonomy for APNs and pharmacists and allows us to play a more direct and active role in clinical decision-making processes. It also gives the physicians more time to see new or complex patients and helps to improve our professional image, especially when we see the patients in the clinic independently. Lastly, it's actually smoothen the patient's journey and help to reduce waiting time to see the doctors. So next I'll move on to what's going on now. So the image over there is actually my first clinic session with the rheumatologist in the clinic, and you can see my stethoscope over my neck over there. So we just sit behind to do some observation and then be available when the doctor is present to allow us to do some physical exam. Okay. So some challenges include that some patients sometimes are concerned about the standard of care versus doctors. So sometimes the patients are not very familiar with what the pharmacist does. And this will require physician champions as well as proper patient communication to help to overcome this. There's also some difficulty in carving out niches for each healthcare professional. So the clinical framework and the agreement itself needs to be well established. So sometimes there's a lot of misunderstanding in between. If let's say you're doing certain people's job or feel that you're encroaching to some other person's niche, so it helps to avoid overlaps in effort. So the next thing is to have some proper escalation pathway that will need to be established. So it's very important to have proper escalation from primary physician on call to the registrar. So that helps us to properly escalate any patients that require help. Okay. So for us, I think for myself, I think I managed to see a few different cases. So there's one patient that I had a HB drop from about a baseline of about 910 to about 6. And just picked up during his routine blood test. What I did was, of course, call the patient, make sure he's okay, make sure there's no active bleeding, and then we will move on to things like escalating to the primary physician to see whether or not there's need for any admission and transfusion of bloods. Yeah. Another case was about another uncle that I saw had this gastric pain and this gastric discomfort that he had. And I was seeing him for rheumatoid arthritis. So unfortunately, I escalated to the primary physician because there's some weight loss as well, and I was a bit concerned that he might have some underlying malignancy. So actually, I refer him to the polyclinic to get it checked out. Okay, so they did a physical examination and they found a gastric mass. Unfortunately, this was not his primary cancer. The patient actually had B-cell lymphoma that has spread to the gastric. And I picked it up during a routine phone call consultation. Yep. So it's very important to have some proper escalation pathway just to minimize any potential issues. So the next thing is the retention of skills. So this actually is highly dependent on practice setting. So inpatient wise, you don't really talk to the patient very much, or you don't really touch the patient very much. So there's a lack of physical exam as well as history taking skills that may be lost. Okay. The other thing is if we do virtual monitoring, things like video consult or like phone consult, you don't have the element of the physical examination of touching the patient. So that kind of skills may also be lost. And currently, there are no guides on how to maintain these competencies locally. And then finally, we have some difficulty expanding to the GP as well as community setting because we're worried about uh, encroaching onto their space, and sometimes it might require a lot of communication and I guess engagement before we are able to spread into those areas. So moving forward, I guess from the personal practice setting, we are in Singapore General Hospital, what are we doing is that we are trying to convert all pharmacists run clinics to collaborative prescribing only clinics to ensure that everybody that's running the clinic has appropriate training and skills in history taking, assessment, as well as physical examination. This helps to maintain consistency in clinical standards for the patient. Not to say that if you're not a collaborative prescriber, you have varying clinical standards, but more to maintain consistency. And then also to collaborate with physicians to refresh or enhance learning from the course. So like I mentioned, the course is like a 3-month one-time thing. And after that, you are accredited to provide the service. Okay, but it's very important to reinforce certain things like history taking, basic physical exam, during rounds or certain courses that you can do with the physicians. This is specific to rheumatology, so things like X-ray, CT scan images, diagnosis, as well as investigations. And for inflammatory bowel disease, things like colonoscopy, CT, as well as ultrasound images, that can be helpful to supplement the learning as well as the patient's clinic experience. And then finally, we also established a community CPA. So this is part of the team that provide home visits. So things like nurses, physicians, and then the pharmacists will tag along to help to provide drug information support, med recon services, as well as participate in the clinical decision-making process. Yeah. So that's all I have for the Singapore update. So if you all need any, you have any questions, you can feel free to let us know later in the panel discussion. Thank you.
All right. Thank you so much, Ms. Kaisen, for sharing your experience, information, and also insights. We're very honored and delighted to understand how the program is. I do think that it's very well established as there's checkpoints. For example, you have the trainings, you have the OSCEs and the exams, and it also gives the pharmacists a good competency for their base, and also it gives a more active role and it helps many aspects of the healthcare system. Once again, thank you so much, Ms. Kaisen, for the detailed presentation. We will hear
Thank
from
you.
you more soon in the panel discussion. And that for the participants, please do stay tuned.
So thank you so much, Ms. Kausin. So now let us now turn the opportunity to the next speaker. So as we all know, we were now proceeding to the pharmacy practice here in the Philippines, where the role of the pharmacist has also been evolving. So through national legislations and various programs, pharmacists in the Philippines have taken on expanded responsibilities, including the National Immunization Program. So it is my pleasure to introduce our next speaker. He is the lead for administration and research at the Philippine Pharmacists Association Training Program for Immunization. So to share more of this with his extensive experience in pharmacy training and public health program, we are honored to welcome Mr. Miko de Guzman, who will provide us with a closer look at these developments and how pharmacists are shaping healthcare through expanded clinical services and their impact on healthcare in the Philippines. So, Mr. Miko, the floor is now yours.
Thank you, Alexa. Good afternoon, everyone. I have only 10 minutes to present, and I have a lot of slides with pictures. I'd like to invite everyone to join me first in a survey in Menti. I hope you can access the link. I will try to copy the code as well. Can you access it?
Yes, we can access it.
So I'll just try to start the presentation. Oh, wait. I'm trying to share it here. Can you see my screen?
It's still loading on my end.
But I think there's a lot of answer already in the Menti. Oh, you're sharing window on another desktop. Okay, sorry. But I think the majority of the participants are coming from the Indonesia, followed by the Philippines. Yeah. Wait, I'll try again. Sorry.
It's all right. It's really nice to know that we have a lot of Indonesians here and also the Philippines.
Yes, surely. I think most of them are students.
Yeah, I think there is. So majority are from Indonesia, Philippines, Myanmar, Japan, Singapore. Yeah. Thank you so much for joining the event today. So there's another question. So the next slide. So I just want to know if you have already excuse me, you have already um participated in vaccination or try to assist, or you just want to learn, or you're just interested. You can pick any of these um choices. So thank you so much for answering. This is just for my own copy. So that I will know if what type of audience I am talking to. So the first one, no one um have the experience to administer real vaccines. So zero. We have two, I already assist. We have also two, I have not vaccinated yet, but want to learn. Oh, three. And then there are nine. I'm interested to become a vaccinator someday. And the majority, I'm just here to learn more about the topic. So I think I'm good. So thank you so much for your participation. So I will now go back to my presentation. So I'm here to give you a background about the immunization in the Philippines. So in 2014, there are a lot of dialogue and visits from the Philippines. So the chief executive before, the chief executive officer from the International Pharmaceutical Federation, or the FIP, give a challenge to the Philippine FDA, that is to provide immunization for the Filipino pharmacists together with the Philippine Pharmacist Association. So the purpose is to increase the people's access and not to compete with the doctors or nurses. So we just want to provide more services to the Filipino people. And then followed by the January 2015, there are multi-sectoral group under the PPHA, and they all participate in the pharmacist role in the adult immunization. And then followed by the December 2015, we have the development of the training modules for the pharmacists. I think this was led by the University of the Philippines in UP College of Pharmacy. So majority of the modules started um, back then in December 2015. And continuously in 2016, there are meetings with the PRC Board of Pharmacy regarding the accreditation of the training program on immunization. And there are also some guidelines and protocol that need to be addressed in terms of the inclusion of the pharmacies and drugstore in 2016. And the exciting part was during the 2017, 2018, wherein there are some regional trainings across the Philippines with the help of with the help of the Filipino pharmacists who are American certified immunizers. So they got their license or they got their certification in APHA in US. There are also some turning point in the pandemic. So the pandemic also somehow helped the Philippine government to see that pharmacists can be tapped as one of the vaccinator that time. So there is a release or sorry, in 2016, the idea of having the immunization is also embedded in the pharmacy law. So with the new pharmacy law in the Philippines, so it is already included that the pharmacist can administer adult vaccines. So everything is aligned on that preparation from 2014 to 2016. Now, it is only by the time of pandemic that the resolution for that vaccination is allowed. So I have here a sample dialogue from 2021. The first national program manager is Sir Brian Posadas, which is, I think, majority of you are familiar since he is also a former president of AYPG and the YPG Philippines. So those were the days in 2021. So yeah, but right now we have the cycle for that. Of course, it started in 2021. We call it IPCP. However, the IPCP cycle is already paused, so it is already expired. So the resolution or the grant from the PRC Board of Pharmacy is already expired last July 2024. I am showing on the screen a sample of the law. So this is our legal basis for the development of the program. So it is says here under the Republic Act 10918 Philippine Pharmacy Law from 2016 under Section 4 scope of the practice of pharmacy in letter G that a pharmacist can administer adult vaccine as long as they shall undergo training on the safe administration of the adult vaccines and management of the adverse event following immunization. So any Filipino pharmacist can participate here. So regardless of your practice, whether you are working in regulatory, public health, manufacturing, and other field, you can apply to enroll. This is the one that I am referring earlier. This is the Professional Regulatory Board of Pharmacy Resolution number 5, series of 2021. But this is already expired last year. Another joint administrative order from our Department of Health during the COVID-19. This is also embedded in a new law, Republic Act number 11525, wherein the pharmacists and the midwives are entitled to have the standard training for the COVID-19 vaccines. So meaning pharmacists can also administer vaccines for COVID as long as they have the training for it. So this is the guideline, short background for that during the 2021. So this is for COVID-19 vaccines only. But if they want to become certified, they will enroll in the program. So it is divided into 4 levels. We have level 1. The level 1 is composed of 16 hours self-paced online modules back then, okay? And then the level 2 is composed of 16 hours facilitated online modules wherein I am the host in level 2 before. Then level 3 is a composed of 8 hours preclinical skills. So again, level 1 is online modules. Level 2 is facilitated online modules. Then level 3 is a preclinical training. So they said that the level 3 is the very hard stage. That's the very most people afraid of level 3. And then lastly is the level 4. So level 4 is supervised, meaning this is a face-to-face training with a doctor or a physician or a certified immunizing pharmacist. But again, that is from the past. So we are updating the guidelines. So the expanded role of a pharmacist in the Philippines can practice in this area. So you can participate in education and campaign, just like what we are doing right now. We can also participate in vaccine distribution, in cold chain management. We can also practice in pharmacies or drug outlet, the vaccination itself, and we can also participate in hosting a venue for vaccination, such as medical missions. On the following slide, I am just showing you my own experiences during the certification program. This is my experience in the local government in Municipal Health Office of Carmona, Cavite. And there are some articles that you can also visit in YPG Philippines Medium. Of course, we are from YPG, so we will be promoting our article. So you can visit the Medium anytime to learn more about other vaccination efforts, because there are a lot of successful certified immunizers in the Philippines. What is going on now is we have this new guideline from the PRC. This is the new framework, what they call Certification Program for Immunizing Pharmacists. So no need to read everything, but just remember that we have 3 levels. So we have the training. The training will be open to all, just like what I am representing right now, the Philippine Pharmacist Association, or the PPHA. So they will be the training provider, and others can also apply as a training provider. And then the next one in the pink color, we have the assessment from the PRCBOP recognized specialty group. In this case, they call it the CDG, or the Competency Development Group. So after training in the PPHA or in the training provider, that's level 1 and 2, you will now move to the level 3 and 4 in the assessment part, in the middle one. Then the last one, the one that will give you the license or the certification, will be the PRC. So currently, this is the logo that we are using. You can see here the training program for immunizing pharmacists, Philippine Pharmacists Association. And currently in the Philippines, we only have 1,435 produced by the PPHA as of 2024, since the program stopped last July 2024. And currently, per law, we are only administering flu, pneumococcal, human papilloma vaccine, and the COVID-19 vaccine, only 4. And last one, this is our current standing. We started last January 2025 to reset everything. We have a ride shop and the installation of the new Mancom. We are led by our PPHA president, Dr. Dakanay, which is also the national program manager. And then followed by the February to April 2025, wherein we produce module. So before, the module is only 6, but right now the module that we created is 20 modules, and we have 15 authors. The 15 authors are all experts. There are some doctors, some pharmacists, and this is aligned to the new guidelines that I presented earlier. The one with the blue, pink, and yellow. So we are proud that the module is already done. Now, following that process, we have last May to July 2025, the trainer capacity building. So we selected and we screened potential trainers under PPHA, TPIP. We call it TPIP. There are a lot of acronyms, sorry. So TPIP stands for Training Program for Immunizing Pharmacists. So yeah, so currently we have batch 1 successful is 16 and the batch 2 successful is 10. So total of 26. And then from August to December, that's finalization. The goal is to apply for 2026. Currently, the application to become a training provider is not yet open. So we hopefully to launch it again by 2026. So that's the perspective from the Philippines. And if you have any question about immunization, you can email me through this email. Thank you so much.
Thank you so much, Sir Miko. So, for a quick overview from Sir Miko's presentation, so we all know from his presentation that the Philippines is some way leading the way in the Southeast Asia, with pharmacists taking an active role in immunization. So, a role that many other countries in the region that haven't done yet. So, this only strengthens public health locally, but also opens opportunity for future collaboration, sharing best practices and helping other countries consider similar initiatives under proper regulation. So it is an exciting example of how Filipino pharmacists are leading innovation in patient-centered care, especially in the immunization program. Since we all know that usually vaccines are administered only by doctors and nurses. So, however, from today's presentation, Sir Miko highlighted that in the Philippine practice, where trained pharmacists are now authorized to administer adult vaccines. So with that, this only not improves accessibility and efficiency in healthcare, but also set somewhat an inspiring example for other countries to consider expanding pharmacist roles under proper training and regulation. So grateful for the valuable insights by Sir Miko de Guzman for sharing these insights in evolving role of pharmacists in immunization. So up next, are we now going to proceed for the panel discussion? So thank you to all our speakers for your sharing, and we can clearly see how diverse the prescribing frameworks are across Southeast Asia.
All right, we are now inviting all speakers to start our panel discussion. We are also inviting Mr. Taiwan, so I'm so sorry, Mr. Frank from Taiwan, and also Mr. Shanlim from Malaysia to join our panel discussion. I hope everyone's here now. All right. So we'll proceed with, since we have limitations on the time, I'll ask a question, and hopefully all the speakers can share their opinions on the question. We'll start with on how in Taiwan and Malaysia progress on equipping the pharmacists with an advanced service. I'm giving the floor to Mr. Frank, and then we'll proceed to Mr. Shah.
Okay, thank you, Nisa. Hi everyone again. I'm Frank. So I'm really glad to hear the experience from Philippines, Singapore, and Thailand. So in Taiwan, I think we are taking a slight different strategy because we didn't really expanding our prescription right for pharmacists, but in parallel, our focus is more on how to establish reimbursement for clinical service or pharmaceutical service for pharmacies. So we believe the beyond dispensing means the pharmacy is paid for our brand, not just for the handling over, but just dispensing. So our uh, Pharmacists Association is focusing on reimbursement with national health insurance on chronic disease, ICU, and pharmacist clinic. These three services are all reimbursed for pharmacist service. And for our organization, Taiwan Young Pharmacists Group, we are focusing on the access of medication to expanding the pharmacist can do in pharmacy and let the patient get more access to this medication. So our current focus are on hospice care and HIV patients. So first, currently most of our pharmacies don't storage any control drugs like fentanyl or morphine, but this kind of medication are essential for patients with end of life and need to have pain control. So we have our collaboration policy with government and to educate about our pharmacists in Taiwan that this kind of service essential and we let them know how to provide this kind of service. And also we have several years experience to promoting people living with HIV is important. For example, this month is World AIDS month, so we will educate pharmacy to create a stigma-free environment and to let patients have more accessible accessible way to collect their prescription so that they don't need to go back to hospital every time. And I think that is what Taiwan do. So we think the beyond dispensing is more like we can do more service, and because Taiwan is also evolving our education system more and more from the pharmacists are now in Taiwan. So we want to expand our professional than just dispensing. But I'm really also looking forward that Taiwan can expand our prescription right in the future. For example, vaccination or provide more mild ailment medication to patients so that they don't need to go back to see the doctor every time and let the pharmacist do a lot of work to help patients get more healthy. Thank you.
Okay, thank you so much, Mr. Frank, and we'll have some input from Mr. Sean regarding your country's progress on equipping the pharmacists with a more advanced service.
Hi. Thank you very much, Lisa. So, once again, I think it was a very great sharing set by three of the speakers, Mr. Miko, Miss Kaisin, and also Miss Jenny. So, it just reminds me that how pharmacy professions can grow, right? There's no ceiling of it, and the only ceiling is the country policies, regulations, or maybe the whether the pharmacists are very self-initiated to actually they want to grow or not. So I'm glad to see how our neighbors country are actually growing. So in terms of Malaysia right now, is that because that we have a very separate system in healthcare system of public healthcare and also private healthcare. So both systems are not really integrated. So what is actually we see that right now is that in terms of the private pharmacy sectors that we are very much into, we did actually trying to actually to advance into like for example like what Philippines is doing in vaccinations, and also that we wanted to actually to even advance into different things. But I think for our countries, we do actually still require to take some times, and also may still need to learn from how Singapore and also how Philippines has done it. But currently, that what we actually focusing ever since I think last year itself that Malaysia Pharmacy Society, we have actually taken approach in advocating self-care among that actually to lead by the pharmacists itself. We work with CPA and all that actually bringing their modules. So some of the modules which is like, for example, that how to actually to diagnose and so to treat like URTI cases among the community, as well as we also like recently we're also advocating that how can actually pharmacists play a role in pre-diabetes, because how diabetes is actually in Malaysia is one of the highest diabetes rate amongst ASEAN. So this is something that we are looking at how pharmacists play a role in pre-diabetes, because in terms of pharmacy in clinical settings itself that we are seeing that a lot of pharmacists actually involved in different like clinical lead clinical pharmacist lead settings, or maybe some of the module, some of the care services that ambulatory care services that we are providing. So I think that we are going towards that, and also that we also are exploring that how can we actually bring in the specialist pharmacists, the level to Malaysia, because we are seeing that more and more pharmacists in Malaysia are trained very in depth in terms of clinical. So how can we actually to have these recognitions, like how specialist doctors in Malaysia as well? This is something that we are progressing, and also that hopefully that we are able to see some results in the next few years.
All right, thank you so much, Mr.
Mm.
Sean, for
Mm.
sharing on how Malaysia is trying to improve the pharmacist role. I'm now going to ask our previous speakers, Mr. Miko, Ms. Janice, and Ms. Kaisen, about the other initiatives that your country might have. This might be a good reference for the other countries. For example, other than that you have presented, I remember Thailand was more focusing on the accessibility, Singapore on the collaborative prescribing, and the Philippines on the immunization practices across the country. Do you have anything more to share, like the other initiatives you have in your country? We can start from Miss Janice, and then Miss Kaisin, and then Mr. Miko.
All right. Thank you very much for sharing the information for various countries. Another initiative that we are in progress in Thailand is one of the e-prescription system that we are going to let the patients who fill the medications in the drugstore or the drug retail pharmacy, because a lot of times you will see a lot of people or a lot of patients very crowded in the hospital itself, and the waiting time at the pharmacy is something that the patients actually complain, because that is the last step of the visit in the hospital. So that is one of the initiatives that we are initiating right now in Thailand. Another one is because as of now, the personalized medicine is very important in various diseases. We are also realized how important it is. We are initiating a short course training for the certified pharmacists to be able to provide a service in pharmacogenomics in the community pharmacy. Basically, if they have some kind of test in pharmacogenomics, and then they would like to consult the pharmacist in terms of how to interpret the result, what kind of medication that they need to be aware. They can consult the basic information in the community pharmacy as well. That's a kind of important initiative that's going to happen in the next few years in Thailand. Also, the vaccinations. Currently, the regulations of the healthcare providers who are going to vaccinate the patients are, as a pharmacist, we are working on it right now. I think it's going to be in the next 2 years that pharmacists can be a vaccine provider too.
All right, thank you so much, Ms. Janice, for the updates on the Thailand initiatives later for the pharmacists. We are moving to Ms. Kaisen.
Yeah. So thanks everyone for sharing. I think in Singapore, what we have also been doing is also this vaccination program. This so we have been certifying people for vaccination, or certifying pharmacists for vaccination since I think 2019. It's been going on for about 6 years or so. I just checked the website. So basically, it's actually a course that's provided by NUS, and it's done by our nursing colleagues alongside the pharmacist colleagues. So they are sort of a collaboration. And once you're certified, you are able to give vaccinations. And most of the time, the community pharmacists are the ones getting certified. So those from Guardian, Watsons, and Unity, which are the three big chains in Singapore. Yeah. So currently now you can actually get your full vaccines at certain Unity, Guardian, and Watsons outlets, but for a fee lah. And they're also working towards reimbursement through our national programs, which is things like MediSave, and see whether or not they're able to deduct from there as well, because flu vaccinations are quite essential for some groups of patients, and they should be reimbursed. That's one thing. I think the second thing is also about this community care, community-based care that we are moving towards, or value-based care. And we're trying to push two things lah. Okay. So one is like I said, community care. Second thing is this value-based care. And sometimes it comes at a price, I guess. And sometimes when we do community care, we have to increase our healthcare expenditure, and then that, on the other side of it, the value-based care portion, that does come down. So it's very important for us to manage that as well. The expectations of the patients, expectation of the healthcare team, okay, as well as our own expectations as well. That's very important. We cannot have a win-win situation most of the time. And just have to reach a compromise, I guess. Yeah. I guess this is the two main things.
All right, thank you so much, Ms. Kaisen. We're now moving to Mr. Miko.
Okay, on my end, I think it always boils down to the what we call the patient-centered approach, wherein in terms of dispensing and in terms of the additional service that we provide to our patient, regardless of the country, we always need to remember the borderline of our profession to the doctors, nurses, and pharmacists. I have only 2 points. My first point is that in terms of providing services in the Philippines, if we will try to provide more access and more services, I think it is all. I think it is right to provide additional fee, like additional payment to the pharmacist who will provide that service. But we do not have that yet in the country. So we wanted to have a very good guideline on that, wherein there are checklists maybe under the universal healthcare law. There are some checklists that are readily available in the community pharmacy, just like in other country, and then the pharmacist will do it. My second point is that in terms of the prescribing pattern, I think that our country is not yet ready, or we haven't received any formal document, on my own opinion, because last year we have some controversies in terms of dispensing physicians. So if we will try to position the pharmacist in terms of in here in the Philippines, we wanted to make sure that every dialogue is with diplomacy with other profession. So dispensing physician, prescribing pharmacist, I think it should always boils down to what we really want. And it always boils down to the patient-centered approach. And yeah, I think dispensing medications, and if we will also do prescribing here in the country, it should have a very good starting point, so that the practice will not be overlapping or will not be abused by other professionals. So yeah, I think, but the most important thing is we have a lot of competency that we can still push on in terms of the practice. So I hope the Philippines can learn from the other countries as well, and vice versa with the vaccination. Thank you so much for the opportunity.
All right, thank you so much, Mr. Miko. So we have heard from 5 countries from this point. Maybe from Mr. Sean or Mr. Frank, since we have received other inputs from the other countries regarding their progress. Do you have any other anything to add or anything to ask again before we proceed to the Q&A session?
So maybe just to share more a bit that we while recording, I was like quite impressed about what actually Singapore and also Philippines achieved, to be very honest. So but one of the things that we actually in 2021 and 2022, Malaysia actually tried to implement the vaccination courses, which we allowed that our pharmacists to be trained to be to vaccinate. So, but what it happens, it was like because that time was during COVID-19 time, I think that everyone was quite clear, and our country actually required the most resources to be utilized for the vaccinations in order to achieve the most vaccination rate among the in the country itself for a better protection. So we actually started that, and it was consented by the Minister of Health during that time. But I think after that period, because things change and all, it started to quiet down. And recently, we actually brought it back. Because we actually brought it back, like, saying that how actually pharmacists can play a role in influenza vaccines. But I think that I can share with you guys that it actually got a very negative feedbacks actually from amongst our doctors, that actually they thought that we were actually wanted to actually to took away their role as a vaccinator. Actually got a very controversial heat up discussions that during recently. So but I think that one thing we see is an opportunity because in Malaysia itself that the role of pharmacists is getting more and more prominent in clinicals, how pharmacists are being appreciated a role in as a clinical pharmacist. And also in community pharmacy has become more and more accessible and trustable by the community itself for the primary care service. So but of course it comes by some obstacle that how our doctors are being more and more challenging the role of pharmacists. For example, that we pharmacists cannot use the word prescribing and cannot use the word screening because these two words are taboos for them. If let's say they're being used by any of the pharmacy service materials, right, it will be actually caught, and also that we will be expecting like some enforcer to actually come in to actually to do something to us. So we actually in the midst that like what Miko mentions, a diplomacy between the healthcare professionals are very important. This is where that we are trying to balance that, but in the meantime, not hindering the growth of pharmacies. So just one last thing that we share that Malaysia Pharmacist Society, we also actually have last year we actually met our Minister of Health, and also that we got their blessings to actually to build something called ERX Exchange, EPS Exchange. So what it means is that in Malaysia, there's a lot of e-prescriptions players and also telemedicine players, but there's no exchange system to actually to do the governance of the e-prescriptions. So this is where that Malay MPS actually saw this opportunity that how pharmacists, because we are the one that assessing the prescriptions and all. So we took this opportunity to build this EPS exchange with the Minister of Health, and also with the objective that we hope that there's a better governance of the e-prescriptions, and also the better quality and also better tracking of the e-prescriptions together with with our Minister of Health. This is something that is building on, and something that we have actually worked with different vendors in Malaysia to actually to build it. So expecting that in 2026 or maybe early 2027, it will be implemented all across Malaysia. So this is something that we are actually building the infrastructures for our pharmacists to have more roles, and also that have more things like how MPS, which is actually coming in to support the growth of pharmacy professions in Malaysia. Yeah.
All right. Thank you, Mr. Sean. And I'll kindly ask Mr. Frank if you have anything to add before we proceed to the Q&A.
Okay, I think I just mentioned echo a little bit about what Janice just shared about Thailand's policy, because you mentioned about initially you don't have for the scope like currently. So because about the patient, since the service is really satisfied and expand to more mild ailments. So I think this is also what we can think about the patient, because they're using the service, and we as pharmacy, we have this kind of knowledge. We should use the patient's needs to negotiate with government, with other healthcare professional, because in Taiwan, actually, a lot of pharmacies in pharmacy sell antibiotics or other prescription drugs. I think it's also in other country, but we are not actually really legal. But I think we need to fulfill this kind of gap and ensure every patient have the safety medication use, and we pharmacists don't practice like we are illegal, this kind of thing. So I think it is what we need to work as a NGO or as a pharmacist to work hardly, and really thankful everyone to share your experience. Thank you.
All right. Thank you so much, Mr. Frank.
Sorry. Hi, maybe I can share a little bit. I think what Malaysia is experiencing is essentially what Singapore initially experienced as well, especially in the GP setting. It's very difficult to change their mind. I think Sean will understand what I'm trying to say. Yeah. And there are a lot of red tape that you have to go around because this person not happy, person not happy. So I think it's very important to have a certain platform that you all can all talk and communicate with each other. It has to be done at the ministry level. It's very hard for us to do it at the ground level because there's no way that we can engage with the minister or understand what they're thinking about or what is their concern. So the different societies, the tops, the leads of all the different societies need to come together and talk. And then you come out with a particular agreement that everybody is happy with. Like, so like I said, win-win is not possible. Maybe just compromise. I'm not taking away 100% of your prescribing rights because I cannot diagnose. Okay. But maybe I can do some more stable patients that maybe it might be easier on you, your load. Maybe you don't want to see those stable patients. You want to see the maybe more complex ones. I guess the hospital setting is a little bit easier because they're paid by the hospital, not necessarily private. But private is going to be a lot more difficult in terms of expanding into your role. And you feel that you were like encroached into their space and you feel very uncomfortable. And that's normal. Yeah. But it will take a lot of communication, I think, and that requires some physician champion as well. Maybe you can engage a few of them in the different states, I guess. And then you can see whether or not these people, what are their challenges. Do some focus group discussion and see whether or not they're able to tell you what their worries are about and whether or not we can help to reassure them or whether or not we can help to, I guess, complement what they are doing already. Yeah.
Yeah, agree. So anchor what Ms. Kaisen actually mentions. This is something that we are doing behind the scene right now through MPS and also with the Minister of Health, with the key people, and also we are trying to lobby the physicians that are actually very supportive in the multidisciplinary practice. So there's a say, just a joke that Malaysia is always like behind Singapore 3 to 5 years. So that what I hope that this is something that what Singapore is right now, that hopefully Malaysia will be there as well. But this is something like what Kaisi mentions, that this is a process that we are doing right now, and hopefully that we are able to see the fruits later on in near future. Yeah, thank you very much.
Yeah, just something that I would like to add more in terms of the provide information to the Ministry of Public Health is other than the satisfaction with the patients, we also include information on the cost utility that when the patients, come to, comparing the price between patients go to the hospital and patients, go to the drugstore, which one is more effective. So that is a very strong foundation to, like support your new policy to implement into your country.
Yeah, I agree. Cost savings is a big issue, especially in the government setting, because they all want to make sure that the healthcare is effective and also cheap. Yeah. I think for us at the pharmacist prescribing services, or our pharmacy run services, the cost of it is significantly lesser than when you see a specialist physician. But you get very similar standard of care. Okay. So it's just like I said, of patient communication and then talking about reimbursement and also about I guess the duplication overlap of efforts and people being unhappy and things like that.
All right, thank you so much. It's amazing to see that there's quite similarities in each of the countries for certain problems. Hopefully that we all as a region can all proceed, so no more being left behind. So we're all progressing in the good way and also catering on our own country's needs. So thank you so much, everyone. Thank you so much, Mr. Sean and also Mr. Frank, for joining this panel discussion. I think Alex will be moving to the most awaited moment for the Q&A session.
Yes, we're moving forward for a Q&A session, but also we would like again to once again extend our heartfelt thanks to our speakers and discussant Mr. Frank and Mr. Sean for sharing their valuable insights and experiences. So their presentations and also their valuable insights have truly set the stage for a very engaging discussion. So at this point, we would like to open the floor for our Q&A. So let everyone take this opportunity to ask questions in the chat box. So feel free to ask questions from our audiences. And if ever you wanted to open your mic, kindly just raise your hand and we will call you out. So yeah.
Ask away, everyone, since we have a limit for time. Hopefully we can cater to more questions, hoped. Ask away, everyone. All right, maybe before we start receiving the questions, I think everyone is still shy. We'll ask
Let's go, guys. Don't be shy.
all right, so prior registering for this event, we do ask some of our all of our participants if they have any prior questions. I think we'll proceed to, we have a question for Miss Janice. We have a question from Papua New Guinea and also from Nepal. Will pharmacists have to be certified to prescribe, and also are PharmD graduates capable of prescribing medications?
Um, if you graduate in a pharmacy degrees and then you have a license, you have the licensure in Thailand, you can prescribe the medications in any setting in Thailand. So you don't. It's the more important thing that you have a license.
All right, so you do not need an additional course or anything. You just need to pass
No.
your degree, and then you
Right,
have
right.
exam, and then you can prescribe. All right, thank you so much. And we have another question to Miss Kaisen. We have question from the Philippines on how the prescribing role of pharmacists changes impact patient care, workflow, and interprofessional collaboration. I think you can share more on an event that makes you think, oh, this regulation actually works well in this setting. Can you share something like that?
I guess okay, maybe I can share something a little bit different that I don't think other countries may experience, but we had a case, had a situation whereby one hospital's rheumatology department closed down. So there were three doctors, they all left. So the patient load had to be transferred to other hospitals. And we were transferred within cluster, meaning there are three hospitals within the cluster, and one closed, so we had to separate into the other two hospitals. Singapore General Hospital is the biggest, so unfortunately we took most of the patient load. And the doctors cannot cope. They are seeing 30 patients every clinic session, 4 hours, and it's impossible for them to finish. Some of them don't even take lunch. Some of them just continue seeing the patients throughout the whole day. It's very stressful. So a lot of the times, the inpatient clinic starts to slot the patients. So what happens next? So your nurses and your pharmacists have to come in to help to manage this load, and also to help to transition these patients from another hospital's care to our hospital's care, and for them to transition as smoothly as possible. Okay, of course with minimal changes to their medication and whatever that they're taking, and of course minimal impact to their disease. I think that's very, very important as well. Because rheumatological diseases, even though you say yeah, autoimmune rheumatoid arthritis won't die. True. Okay, but if it's very serious, it can affect your lungs. It can cause fibrosis of the lungs, and then it can also, in the end, cause immunocompromise if let's say the medications are not titrated properly. So it becomes a problem now. So it's very essential for us to, I guess, support the service and support the department at that time. So I think at that point, I was just certified also. So it really just, I guess, the timing just matched, and everybody, we managed to get the approval expedited, make it faster, so that we all can help to support the system and support the service as well. So I think at that time, the transition period was difficult. Even the pharmacist clinic also got 20 slots. So we call patients non-stop. Yeah, and like one patient, 15 minutes is the maximum. So most of the time we overrun the clinic as well. So it fortunately we had a few of us that have the certification. So I think that's very helpful. Yeah, so I think that's one way that I think that it's very helpful. Of course, this is a very unique situation that I don't wish on anybody. Okay, because it's a very stressful. Yeah, but I guess the interprofessional collaboration has improved quite a bit, especially with this service, because even though you say, yeah, I'm an independent prescriber, I can prescribe whatever that's in the list, and I don't have to feedback to the doctor. But it's always good to get an update to the doctor about any changes that you've made and your decision making process, and they can help to reassure, to make sure that you know you're doing the right thing, especially in the beginning stages when you are not very clear, not very certain about how you want to adjust your medication. Now, oh, the liver function not so good, but then the joints also not so good. So how much do I want to increase the medicine by? Do I want to add prednisolone? Do I want to give this and give that? What else do I need to watch out for? I think the communication with the physicians help that quite a bit, help to build your decision-making process such that your clinical judgment is improved as well. And then slowly, you start to try to rely less on them and try to rely more on yourself. And of course, anytime you have any questions, this feedback look very important. Help always go back to the doctor and then let them know that, just for my learning, am I doing the correct thing? And just to make sure that the patient is getting the best care possible. Yeah.
All right, thank you so much, Ms.
Thank
Tyson.
you.
We'll proceed for the question to Mr. Miko. So we have a question from Thailand. So when the person was a pharmacy student, he or she didn't learn how to inject vaccine. Um, how did the Philippines start with the vaccine curriculum or topics for the students? And how do you like to encourage pharmacists to do this role, and how to train or certify pharmacists who can deliver the vaccines to people? So what was the start for the Philippines to start this initiative?
Yeah, thank you so much for that question. I think some part are already discussed earlier in my presentation. So it started last 2021 officially, and along the way in between there are a lot of stories. So if I discuss everything, maybe I I will consume around 20 minutes. So there are initiatives that the immunization is or was already included in the curriculum. However, we still need more time to improve the curricular content of the immunization. But hopefully, the goal is to multiply everything, to become a multiplier, so that the schools of pharmacy in the Philippines will also have the chance to embed the topics about vaccination, so that the student, when they graduate, then they took the licensure exam, maybe the two levels will be optional, so they will be upgraded, or they will be more advanced when they already have their license. Now, if they want to pursue vaccination, they can always apply, whether in the training provider or in any training provider. So there are already push about students in the Philippines to become an immunizer, additional certification on top of the license. So in terms of the renewal, the license as a pharmacist is already combined with the certification. But I think in the few years to come, it will be changed. Yeah.
All right, thank you so much, Mr. Miko. Hopefully, for the participants who have asked this question, it's already covered with the three speakers. I think you can proceed to the live questions in the chat, Alexa.
All right, so for Sir Miko again, there is a question here in the chat box addressed from Miss Naichi from NAPS Myanmar. Let me know the difference between hospital pharmacists and clinical pharmacists according to your country of origin, please. So let us ask for from the Philippines. The difference of hospital pharmacists and clinical pharmacists, if there's any po. Sir Miko.
Oh, sorry. Akala ko iba, Alexa. Sorry. So, I will be the difference.
Yes, sir.
So, I haven't worked in hospital or clinical, but in our country, the hospital pharmacists are usually the staff, or the one who manage all the medication, reconciliation, and the documentation part. We have also clinical pharmacists in the country, but not um, so many. So we have only limited clinical pharmacy hospital who practice that area. Majority, what we have observed is that, again, I am not a practitioner in hospital, but what we saw is that if you are not a hospital pharmacist, but if you are inside the hospital pharmacist, the other are assigned as a antimicrobial resistant head or lead AMR pharmacist. So they are working hand in hand with the doctors and other healthcare professionals in the hospital. So yeah, so in a nutshell, maybe a hospital pharmacist in our country is the staff, the one who work with the other professionals. We're in the clinical pharmacist, the usual thing that the clinical pharmacists do in other country. That's the same here in the Philippines, but we only have limited. Then the other one is the AMR pharmacist. Thank
All
you.
right, Sir Miko, thank you so much for that insight. So can we ask Miss Kausin? about this also for the difference of hospital pharmacists and clinical pharmacist practice in the Singapore.
Sure. So I think Singapore is a little bit different. Hospital pharmacist just means you work in a hospital. It doesn't really mean anything else. But clinical pharmacists, you are basically you're working in a hospital and then you are doing clinical work. So meaning you are facing patients, you are running clinics, running pharmacists run clinics, in whether in the ambulatory care setting or in the inpatient setting, and it requires certain certification. So my own personal institution, we do have BCPS certification, and we do the board certification in the US. So basically, it's like a MCQ exam. I think I don't remember how many, 200 MCQs or something like that. And you get the board certification, and it's once every 7 years. Once that is done, then you are considered a clinical pharmacist. And then in addition, of course, past that BCPS, you can get additional certification. So, for example, now currently I'm doing my PharmD. My PharmD is a postgrad course, so it's separate from your graduate course. And then you sort of do it only when you are of a certain experience locally. That's what we usually do. So it's not like, oh, I graduate already and then the moment I graduate the next year then I can go PharmD. No. So usually it's sponsored by the hospital and then only for clinical pharmacists, and then they will actually uh give you after like maybe 5 to 6 years of experience, then they will offer the program to you. Yeah. So then that's basically what a clinical pharmacist is now. So basically you're focusing on clinical work. But as hospital pharmacist, you can be an admin, you can be an IT pharmacist. Like what Nico just now shared, can also be a antimicrobial stewardship pharmacist, drug information pharmacist. Those are all hospital pharmacists. Just that for us clinical is just basically when you see the patients face to face and run services. Yeah.
All right, thank you so much, Miss Kaisi, for that insight. So, let me proceed to let me ask Miss Janice about this written question. Good day. With the expanding roles of pharmacists in Asia, are we compensated for every other skill or competency gained in our profession, or do our remuneration remain the same? Secondly, still about the expanding roles, do you think the current curriculum needs further improvement or alterations? If so, how can we incorporate such competencies to instill to pharmacy students?
Okay, so with the skill that is remunerated in Thailand, actually we focus on the prescribing pharmacist in the drugstore. We usually have the fees that get reimbursed by our Ministry of Public Health. Basically, you include both the medication fees and also with the pharmacist fee. However, if you work in the hospital as the clinical pharmacist or as the clinical pharmacist or the hospital pharmacist, you usually just get your income by base salary in your hospital. And if you are on duty at night shift, you're gonna get more in terms of the income based on how many night shifts that you covered on that day. Those are the things that usually happens in Thailand. And if you are practicing in a very, rural area, you're gonna get some incentive for those areas because that is limited resources. So that kind of like being an incentive for the pharmacists to, motivate them to work in a very long distance to the city. So basically, just to compensate the price that they have to trade off in terms of the practice in the different settings. Another question is regarding the curriculum. The curriculum in Thailand is actually a 6-year curriculum right now, and we gained a Doctor of Pharmacy. We actually have two main programs that we are having in Thailand, which is a pharmaceutical care and in pharmaceutical side, or basically you just focus on that industry. If you are willing to do or practicing in a drugstore or in the hospital, you are mainly to be pursuing in the clinical pharmacy or the pharmaceutical care study plan at the university. And basically, in terms of the curriculum in Thailand, if you are pursuing in clinical pharmacy, you might have a little bit of the subject that is more advanced compared to the fundamental of uh, like when the students doing a pharmaceutical science study plan. However, the fundamental of everything in terms of the pharmacy are pretty much the same. So they can dispense the medication to the patients. They can cover or they can do some IV admixture to the patient if you just practice, because those are something that is the minimum for pharmacists to do. And this is actually required for all the pharmacists and pharmacy students to be sitting in for the license examination. So those are the things that happen in Thailand.
All right. Thank you so much, Miss Janice. Do you have any additional insights, Miss Kausin, about the curriculum setting and how we can progress about it?
Yeah, so I guess two things. One is the remuneration, and also second is the curriculum. So for us, I guess remuneration, there's no difference. Unfortunately, I don't know whether it's unfortunately, but um, getting all these certifications, whether or not like I mentioned the PCPS, the collaborative prescribing, it doesn't increase your pay. It's just more of a additional skill set that you have, just to provide, I guess, increase the standard of your patient care provision. And for us, the clinical setting, if you do want to progress, you do have to do certain postgrad courses and whatnot to prove that you are able to provide clinical care at a higher level, at advanced level. So don't really have remuneration. Second thing is about the curriculum. So locally, I think the curriculum has revised multiple times. Currently, it's still a 4-year program. So it's, like I mentioned, it's not a direct PharmD program. It's a undergrad, and then PharmD is additional 2 years. Okay, there's also a master's program that's about 1 year, and Masters of Clinical Pharmacy that's also offered by the local university. And we only have one university in Singapore that offers a pharmacy program. So I guess currently now there's no plans. When I say no plans, I don't know. But I guess there are some plans of considering a 6-year program. But I'm not sure how that will be implemented as of yet, because currently now they are still I guess still in conversations. Yeah. Then the other thing is also, I guess, curriculum wise, the collaborative prescribing program, they also have decided, they're also thinking about incorporating it into the whether or not the undergrad program or the PharmD program directly, instead of having it separately. Because currently now it's totally separate, and you have to pay an additional fee just to go for that collaborative prescribing program as well. Yeah. So there's some talks about combining it, but then currently now they're not nothing is confirmed yet.
All right. Thank you so much, Miss Kausin. Do you have any additional insights, or Mika, about the curriculum in this, especially in the Philippines, or yes?
Yeah, I don't have anything to add, but I think this is a good opportunity to discuss this kind of topic, because I hope you can still do it some other time, the AYPG team. So I think majority of the answers already exhausted, but yeah, I think I can answer Kiana on the other time. Maybe we can meet some other in some events, Kiana. Thank you so much.
Okay, well, thank you so much, Sir Miko. So for our final question, I think Sir Miko already answered in the chat box, but do you want, sir, to elaborate more about the question Leo had from
Oh,
Japan had said. So let me read the question first so that everyone will know. So I have a question about pharmacist vaccination programs. In Japan, we discussed allowing pharmacists to administer vaccine during COVID-19, but it wasn't realized due to two main issues. First, the legal concerns about pharmacists giving injections. This is now being addressed through pharmacy education reforms. And second, the requirement to diagnose anaphylactic shock, which is legally restricted to physician in Japan, making implementation very difficult. So he is curious about the Philippines experience. So did you face opposition from physician, and now how did you overcome these barriers? So if you want to elaborate, Sir Miko, you can do so.
if the Japan people will invite me to Japan, maybe we can talk about more about this. But yeah, kidding aside, but yeah, there are a lot of challenges if you want to implement something, and there's a lot of changes that you want to innovate. There will be always be something like a politics or a barrier inside. During that time, I was so new in the profession. I think I was only two years in the practice. I just want to make salary and everything. But right now, I am on my eighth year in my profession. I think everything comes to reality, and I realized many things about the problems in pharmacy in the Philippines and other countries. Now, in terms of the reforms and innovation, what the Philippines do before, again, I am just a baby back then, the immunization in our country is an advocacy. It is not a program. So it is just an advocacy. We call it the pharmacy-based immunization program. And the head that time is Sir Brian Posada. So then it came to some extent or some opportunities in other countries. Different presidents of the Philippine Pharmacists Association talked to many people, and yeah, there are some, maybe some sort of timing for everything in God's time, maybe. So from advocacy to national program, and right now we already have thousands of pharmacists, but still that is very little if we will do ratio and proportion versus the population of pharmacists. I think we have 62,000 more or less, but the immunizer is already 1,000 something. I presented earlier, 1,425. So yeah, in terms of innovation and regulation, I think that's a long way to discuss. But as long as you position your country in terms of the legal part, and with the presence of the mother organization and other regulatory authorities, everything can come into place or can be talked about. Thank you.
All right,
I
thank you
think
so much.
I think one more thing about the vaccination. I can't remember if we have something similar like that, but this anaphylactic shock thing, I think it's important to know, take proper history from the patient. And if let's say the patient really does have a history of anaphylactic shock or allergies, then you may not want to let them receive it at the pharmacy, because we don't have the emergency kit or the facilities that's necessary to save the patient if the patient really needs it. We don't even have an EpiPen sometimes, right? Depends on where you are. So I think it's very important to take proper history and also determine, triage your patients. Like, you cannot just accept everybody that comes in and say, oh yeah, you want, okay, come on, I check for you. But more like also have to make sure that safety is in place as well. And then like what Miko mentioned, need to have proper communication with the necessary stakeholders, because if not, it's gonna it's gonna be a political problem, and it's gonna be very difficult to solve, and it's gonna be a professional political problem rather than a personal political problem.
Yeah, that's correct. I forgot to mention about anaphylactic. So that's part of the training. So you will also be trained how to handle an anaphylactic response or anaphylactic emergency like that. So currently we only have adult. So hopefully pediatric will be also allowed very soon, 10 years from now. So thank you so much.
Thank you so much, Sir Miko and Miss Kelsey, for those insights. So, as we conclude the Q&A session, we would like to thank again everyone who joined this webinar, especially to our speakers from Thailand, Singapore, and Philippines, and also to our two discussants, Mr. Sean and Mr. Frank from Taiwan. So, as we wrap up this Q&A session, it is very engaging that we knew how diverse the pharmacy practice across Asia, and it highlights the vast potential of our profession. So by learning from each other experiences, and we can overcome the challenges and continue to focus on what matters most. So delivering patient-centered care and making a meaningful impact on the communities we serve. So as we now come to an end of our program, we would like to sincerely thank again all of you for staying with us and actively participating on this webinar. So your presence and engagement have made this session truly meaningful, and we hope you leave inspired by these insights and experiences shared us today. So yeah, can we have a group photo, guys?
Yes, I think we'll put the presentation down first, and then we'll proceed to the photo session first, I think, so everyone can be visible.
If everyone can turn on their camera, please do so that you will be able to make it to our photo that will be posted on our social media platform.
Yes, we'll wait for another 30 seconds for everyone to turn on their cameras. I'd like to also say thank you again to our speakers. As a student, I've been to Singapore to see how their pharmacy practices, and to Malaysia also is very different from Indonesia. And to see from the Thailand and also the Philippines perspective, yes, we do agree that we have many differences and there's a lot for Indonesia to learn. And hopefully for everyone here for additional knowledge too. All right, I think we have everyone that wants to turn on their camera. You can proceed to the documentation session.
All
I
right,
will, okay, I will lead the documentation. So please, now for the first slide on my screen, 1, 2, 3. You just guys need to be smile. Okay, for the second one. Okay, 1, 2, 3. Smile. Third one, we have 6 slide now. 1, 2, 3. Right. And the last one, 1, 2, 3. Right. Thank you so much.
Thank you so much, Kakadek, for leading the session. Hopefully everyone can learn from each other from this webinar. Thank you so much, AYPG, for hosting
thank you
this
so
and for
much.
collaborating with everyone.
But before
Thank
anything
you. Thank you very
else,
much.
I think there would be a QR code that would be scanned from our audiences so that they can get their feedback form and also their certificates.
Yes, we'll wait for the presentation. All right, we have the presentation. Thank you again, everyone, for attending this. Please do scan the QR code for giving your feedback and also for the certificates. Thank you, everyone, again for joining us. Don't forget to follow IYPG, and also IPSFA Pro for future updates, events, and collaborations.
All right, we would also want to thank this opportunity also for the team behind this webinar. Without you guys, wouldn't be here as well. And thank you so much for Kadek, Mint, and all the committee behind this webinar. You guys did a great job. I hope we can expect more webinars from you guys, AYPG, with the collaboration with IPG, Pro, and sooner or later we will have a big one
Hopefully.
again.
All right, for the form, please do wait from our team to make it accessible as soon as possible. Thank you once again, everyone, for attending. Hope we can learn from each other and have more breakthroughs for our region. Thank you. Have a nice day, everyone.
Have a nice day, everyone. Thank you so much, and have a nice day ahead.
Bye, everyone.
Goodbye, everyone.